Healthcare today has many challenges and many opportunities. I think the challenges that we're facing is the ability to figure out how to deliver better care to more people at a significantly lower cost. In healthcare right now, we have situations where one physician has no idea what the other one is planning or recommending for a particular patient. People die, unfortunately, every year because our healthcare system is disconnected and the access to information that someone might need in order to save your life is literally unavailable.
When my 5-year-old daughter Alice came down with a fever, I assumed the worst. How could I not? News of H1N1 was everywhere. You can't turn on the TV, look at the paper, or even talk to a neighbor without hearing yet another horror story of a child with the flu. I immediately rushed her to the doctor's office. The waiting room was packed with sick kids.
I think it's very common. We have patients coming in with symptoms of the flu or symptoms of something, and it turns out they don't have the flu. And indeed, these are circumstances where they really would be better off at home because they're being exposed to other germs. They themselves might be exposing other individuals.
Turns out it was a false alarm. Alice didn't have H1N1. It was just a cold. A few days later, Alice got another fever. And not only was Alice sick, but I also developed a terrible cough. It turned out we both had a case of H1N1.
With ways to better self-evaluate before coming into the doctor, anybody would be in a better position to know when to come into the doctor's office and then when to stay at home and take care of themselves and follow their symptoms.
Healthcare today is evolving to connected care, to continuous care, to prevention and early detection. And systems like Healthy Circles and MedImpact and the use of HealthVault make that all possible.
Patients have the ability to enter information into HealthVault, and through connectivity to HealthVault and to MedImpact's e-healthcare tools, we can integrate that information with our charts and information here in the pediatrician's office and in the internal medicine physician's office. So we have that ability to aggregate this information and follow these patients either after they've been discharged from the hospital or as their symptoms progress, knowing when to call them in and to act.
I wish I'd seen the assessment app before I rushed Alice to the doctor's office. I wouldn't have panicked so much. It makes it so much easier to connect with our doctors for the first time. There's a place for all of our medical and health information. Immunizations, medications, allergies, and it's so easy to access.
This is an exciting time. It's exciting to see healthcare finally entering the digital age. 90% of consumers feel it's either important or very important for their health information to be in electronic form, for patients to be able to share that information with their doctor, for their doctor to have easy access, and their pharmacist to the information that's necessary to take better care of them.
They use these tools to communicate with us and to understand what they need to do to stay well. I find this is really the next best thing to a house call.
This is going to change lives. This is going to make it possible to take better care of more people at a fraction of the cost, and everybody wins.